My
ahead.
long answer?
Go ahead.
Yeah.
No, go ahead.
Well,
I'll
I
give you
think-
another chance.
Yeah, but this one's going to be even longer because it's even more complicated, I think. But I mean, when you look at PinPoint, well, like again, you can look at the granularity of one relationship, and that'll sort of explain the rest of PinPoint Health. But like, look at Adrian and I, right? Like Adrian and I went to chiropractic school together. We met there. We became best friends, and we're still like, although yeah, we're in this position in the company together as two leaders in the company. We're also friends outside, right? Like our kids are friends. We are involved in every aspect of each other's lives in terms of the things that we do. So that family environment. When I say that PinPoint Health is a family environment, it's not just like this word that I throw out there. It's actually, we try to develop those relationships, and so many of the people that work at PinPoint Health have these like relationships that go deeper than just work. And then I see it with people at the clinics, and that doesn't mean it's with me. Then I see it with, maybe two other people at the clinic have developed a relationship that goes beyond work. And that's what I mean by family. Yes, we're one big family, but we're creating these deep connections. And I think that's really what makes it jive, because when you can connect on such a deep level with your coworkers and you get along and you like one another, then I mean, who doesn't love being around people that are having a good time, having fun? That like everyone loves that, right? Like everyone just likes to be around that, and that's really what we try to do. And we want to avoid conflict and things on individual basis, because we don't want that carried out. And we want that human touch, especially in a world like where AI is becoming more predominant, is going to take over so many spaces. I think one of the advantages that we're going to bring is that human touch, right? Like we're going to be there and we're going to be real people and bring that family environment. But again, it starts on that granular level of two individuals, and then it sort of goes bigger into spreading out.
You get a good sense of when you're hiring these people and talking with the health professionals or any of the staff at PinPoint Health. You get a good sense of what they would be bringing to the table, and how they mesh with the team, right?
Yeah.
So ensuring that it's always a good fit. I mean, as best as we can, ensuring that whoever we add to the team is a good fit.
Yeah.
is key to that perpetual feeling of belonging, inclusivity, in that family style and environment.
And even for me, like when I'm bringing on people to the team, as I mentioned, I'm involved in that, actively hiring every single health professional. I'm not vetting people, and I'm not providing interviews that are focused on, do they know how to treat X injury, or do you know how to diagnose whatever. Again, they're professionals. I know that if you have a license, you're in good standing with your regulatory body, then obviously you must know those things.
For the most part.
Yeah, for the most part, or at least you would hope. But it's not something you could screen for on an interview, right? And so, because they can figure there's ways around that. But really what I'm looking for is the dynamic, right? Like how are you connecting with me? The reality is we are a service industry, right? We are in the service industry. We're dealing with real people. And as you deal with real people, you've got to be able to connect with real people. And I want to be, and that's what I'm looking for. Is there that human connection when I'm meeting with someone, and making sure that they're a good fit for the team? Because that's already what makes up our team, is people that have these connections.